Hello everyone, I'm Zhang Yuqin from Center for Reproductive Medicine, Shandong University. Today, we'll introduce animal models to understand the pathogenesis of polycystic ovary syndrome. Polycystic ovary syndrome is a heterogeneous disorder that is defined by hyperandrogenism, ovulatory dysfunction, and polycystic ovary morphology. The prevalence of PCOS in premenopausal women ranges from about 6% to 20% worldwide, making this syndrome one of the most common endocrine and metabolic disorders in women of reproductive age. With PCOS, the risks for developing type 2 diabetes, obesity, cardiovascular disease, and endometrial cancer are dramatically increased. So, what's the characteristics of this syndrome? A key feature for polycystic ovary syndrome is the excessive androgen production by the ovaries. The dysfunctional hypothalamus pituitary ovary axis plays an indispensable role in inducing hyperandrogenism. Metabolic dysfunction, characterized by insulin resistance and hyperinsulinemia, is evident in the vast majority of affected individuals. This hyperinsulinemia will further enhance androgen production by follicular Zika cells, inducing a vicious circle for reproductive and metabolic dysfunction. Polycystic ovary syndrome is a complex multigenic disorder, with the heritability being estimated as about 70%. Environmental factors, including diet and other lifestyle issues, will further exacerbate insulin resistance and ovary dysfunction. Moreover, increasing evidence suggests for the developmental origin of polycystic ovary syndrome. That is, exposure during gestation alters fetal development, influencing phenotype expression and transgenerational transmission of PCOS through epigenetic mechanisms. As single gene manipulation cannot fully mimic the clinical phenotypes of PCOS women, the construction of PCOS-like animal model relies on androgen or drug exposure to mimic excessive androgen secretion in human PCOS patients. The evaluation indicators of these animal models include dysfunction of reproductive, metabolic, and neuroendocrine systems. The first animal model we talk about is constructed at peripuberty. Exposure of mouse or rat by subcutaneous implantation of 3 to 4-week-old females with an implant containing dihydrotestosterone, DHEA, or letrozole for a period of 3 months. This model elicits an adult phenotype that displays a breadth of reproductive, neuroendocrine, and metabolic PCOS-like traits. The reproductive phenotypes include intermittent or absent ovulatory cycles and abnormal ovary morphology, as we can see from the HE staining of the ovaries. There are increased preantral or antral follicles, thinner granulosa cell layer, and thicker Zika cell layer in the ovaries of DHT and letrozole mice. These animals also exhibit higher luteinizing hormone levels. Peripubertal exposed mice develop an obese phenotype, with increased body weight, adipocyte hypertrophy, and dyslipidemia. The dihydrotestosterone exposure could induce glucose intolerance, but often without insulin resistance. The second animal model is induced by continuous low-dose dihydrotestosterone or letrozole exposure, started at adulthood. This treatment results in similar reproductive phenotypes as the peripubertal exposed model, such as absent ovulatory cycles, decreased fertility, and polyfollicular ovaries. But unlike peripubertal exposure, this adult-exposed model do not develop obesity, therefore represents the lean PCOS subtype. Despite this, the metabolic dysfunction, including glucose intolerance, insulin resistance, hyperinsulinemia, and pancreatic beta cell dysfunction, are all obvious in this model, especially when combined with high-fat diet. Next, we'll introduce the prenatal androgen-exposed model, generating PCOS-like first-generation offspring, which is often constructed by delayed delivery of DHT to pregnant mouse at embryonic day 16.5 to 18.5. This prenatal androgenized model demonstrates the developmental programming of polycystic ovary syndrome. As we can see from the pictures, the prenatal androgen-exposed mice display irregular estrous cycles, decreased fertility, and embryonic defects. They will have delayed vaginal opening as well as longer angogenital distance. When combining with maternal obesity, would produce stronger reproductive phenotypes. These prenatal androgenized animals tend to have normal glucose metabolism and lean phenotype, but exhibit hypothalamus, pituitary, ovary dysfunctions, such as increased gene-age pulse frequency, altered GABA neuron function, and hypersecretion of pituitary luteinizing hormone. The last, we'll introduce the prenatal anti-Mullerian hormone-exposed model, also generating PCOS-like first-generation offspring. This model is constructed by delayed intraperitoneal injection of AMH to pregnant mouse at embryonic day 16.5 to 18.5. These animals implicate AMH as another potential candidate in the prenatal programming of polycystic ovary syndrome. The prenatal AMH model generates hyperandrogenism, ovulatory dysfunction, and increased luteinizing hormone levels, mimicking the reproductive phenotypes of prenatal androgen-exposed model. However, the glucose and lipid metabolic derangements of this model are more serious than prenatal androgen-exposed model. The animals display increased fasting blood glucose, glucose intolerance, and insulin resistance. They tend to be obese with increased fat mass and decreased lean mass. Here is a summary of the characteristics of the above-mentioned rodent models. Taken together, emphasizing the driving role of androgen during development or its direct action for the etiology and pathogenesis of PCOS. While substantial gaps still exist, use of proper animal models will provide further insights into our understanding of PCOS, helping to improve our ability to prevent and treat this disease in the future. Thank you all for watching.